Veklury, or remdesivir, is indicated for the treatment of adults and pediatric patients 12 years of age or older and weighing at least 40 kilograms requiring hospitalization for COVID-19. Veklury should only be administered in a hospital or healthcare setting capable of providing acute care comparable to inpatient hospital care. Veklury is contraindicated in patients with a history of clinically significant hypersensitivity reactions to Veklury or any of its components. Warnings and precautions include hypersensitivity, including infusion-related and anaphylactic reactions. Hypersensitivity, including infusion-related and anaphylactic reactions, has been observed during and following administration of Veklury. Monitor patients under close medical supervision for hypersensitivity reactions during and following administration of Veklury. Symptoms may include hypotension, hypertension, tachycardia, bradycardia, hypoxia, fever, dyspnea, wheezing, angioedema, rash, nausea, diaphoresis, and shivering. Slower infusion rates, maximum infusion time up to 120 minutes, can potentially prevent these reactions. If a severe infusion-related hypersensitivity reaction occurs, immediately discontinue Veklury and initiate appropriate treatment. See contraindications. Please continue viewing for additional important safety information. COVID-19 has impacted countless people and nations across the world. Severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, is the virus causing the COVID-19 pandemic. SARS-CoV-2 has a viral envelope, which contains positive sense single-stranded viral RNA genome inside. A key feature of the virus is the spike proteins that protrude from the surface. The spike protein mediates viral entry and virus cell membrane fusion by binding to the human ACE2 receptor primarily on cells in the respiratory and gastrointestinal tracts. The virus enters the cell by direct membrane fusion and endocytosis, localizing the virus intracellularly within endosomes. The viral genome is then released from the endosome into the cytoplasm, where it is translated into viral replicase polyproteins, which are then cleaved into functional proteins. New viral RNA synthesis is mediated by the replication complex, a collection of viral functional proteins that includes the RNA-dependent RNA polymerase, or RDRP. Additional proteins are translated from this new viral RNA, including those that assemble new virions. These new virions are packaged with a copy of the viral genome and released out of the cell through exocytosis. Interruption of this critical replication step in the viral life cycle is a treatment strategy for COVID-19. Remdesivir, brand name Veklury, interferes with the replication of SARS-CoV-2 and is the first FDA-approved antiviral medication for the treatment of COVID-19 in hospitalized patients. It is a nucleotide prodrug that is converted into the pharmacologically active nucleoside triphosphate metabolite, remdesivir triphosphate, RDVTP, through a multi-step process involving several host enzymes. RDVTP acts as an analog of adenosine triphosphate, or ATP, and competes with ATP for incorporation into nascent RNA chains by the SARS-CoV-2 RNA-dependent RNA polymerase, RDRP, which results in delayed chain termination, 3 nucleotides after the incorporation of RDVTP during replication of the viral RNA. Additionally, there is a second opportunity for RDVTP to inhibit viral replication. In the presence of higher concentrations of the natural nucleotides, chain termination occurs less frequently and allows stable incorporation of the remdesivir nucleotide into a full-length copy of the viral RNA. When the RDRP complex then tries to make a copy of this new RNA, a misalignment occurs when it reaches the incorporated remdesivir nucleotide, causing inefficient incorporation of the complementary natural nucleotide, UTP, and inhibition of further viral genome synthesis. Interrupting viral replication of SARS-CoV-2, is a key approach to treating COVID-19. There is additional important safety information about Veklury. Additional warnings and precautions include increased risk of transaminase elevations. Transaminase elevations have been observed in healthy volunteers and in patients with COVID-19 who received Veklury. These elevations have also been reported as a clinical feature of COVID-19. Perform hepatic laboratory testing in all patients. See dosage and administration. Consider discontinuing Veklury if ALT levels increase to more than 10 times the upper limit of normal. Discontinue Veklury if ALT elevation is accompanied by signs or symptoms of liver inflammation. Another warning and precaution is the risk of reduced antiviral activity when co-administered with chloroquine or hydroxychloroquine. Co-administration of Veklury with chloroquine phosphate or hydroxychloroquine sulfate is not recommended due to antagonism observed in cell culture, which may lead to a decrease in antiviral activity of Veklury. The most common adverse reaction, 5% or greater all grades, was nausea. The most common lab abnormalities, 5% or greater all grades, were increases in ALT and AST. Drug interaction trials of Veklury and other concomitant medications have not been conducted in humans. The dosage for adults and pediatric patients 12 years of age or older and weighing at least 40 kilograms is 200 milligrams on day 1, followed by once-daily maintenance doses of 100 milligrams from day 2, administered only via intravenous infusion over 30 to 120 minutes. The treatment duration for patients not requiring invasive mechanical ventilation and/or extracorporeal membrane oxygenation, ECMO, is 5 days. It may be extended up to 5 additional days, 10 days total, if clinical improvement is not observed. For patients requiring invasive mechanical ventilation and/or ECMO, the treatment duration is 10 days. Perform eGFR, hepatic laboratory and prothrombin time testing prior to initiating Veklury and during use as clinically appropriate. Veklury is not recommended in individuals with renal impairment, eGFR less than 30 milliliters per minute. See full prescribing information for dose preparation and administration. There are insufficient human data on the use of Veklury during pregnancy. Pregnant women hospitalized with COVID-19 are at risk for serious morbidity and mortality. Veklury should be used during pregnancy only if the potential benefit justifies the potential risk for the mother and the fetus. It is not known whether Veklury can pass into breast milk. Breastfeeding individuals with COVID-19 should follow practices according to clinical guidelines to avoid exposing the infant to COVID-19. Please see full prescribing information for Veklury.